Hello everyone and welcome back. You know, the last time I spoke to you, we had just shut down our practice because the government regulatory authorities had suggested to us that we have to go to a level 3 restriction. That meant no aerosols and basically emergency treatment only. Mercifully, under the circumstances, we didn't have that many emergencies, and the one or two that we did have were looked after very well. But as you may know, we have now been reduced back down to level 2 restrictions. And level 2 restrictions frees up for us to see some of our patients. In fact, we can see a lot of our patients. Why? Because under normal circumstances, I practice under level 2 restrictions. You know those people that have come in here and had fillings and they've had that rubber dam, and you say, I don't like it? Well, it's actually good for you. And it's good for my staff and my team and myself because it prevents aerosols coming out of your mouth and potentially carrying the COVID virus. So because of the fact that we've been doing level 2 restrictive work routinely, we feel like we're almost back. One or two things we can't do, being hygiene and scaling, we can't use that scaler that produces an aerosol. So we have in fact gone back to doing hand scaling. So my hygienist will actually scale your teeth by hand. Bit of a luxury, but it's actually magnificent. Keeps your teeth clean and certainly allows those of us that have been undergoing the periodontal treatment to not undo some of all those wonderful things that we've achieved over the time. So I want to make sure that everyone understands that under level 2 restrictions, we are almost back to where we were. Now those patients that were going to have implants, sorry, we can't do dental implants. That's considered something that we can probably postpone, and that's understandable. If you have an extraction that requires to be done, simple extractions are perfectly fine. Surgical extractions, we'll reconsider. So if we think something's going to be a bit difficult, we'll postpone it. Now, I want you to understand what we do under level 2. When patients come into our office under level 2, everyone will be triaged. We'll check your temperature, we'll check your history and see whether or not you potentially could be a carrier of the COVID virus. If not, and you're clean, your mouth will be rinsed with a special rinse that will reduce any chances of the viruses or bacteria or whatever there is being passed on. Once that's done, you can have your treatment. Cleaning will be done, hand scale. Any of the treatment that I do will be done under rubber dam. And unfortunately, as I said, implants and surgical treatment can wait. So for the safety of our patients, for the safety of our staff, we'd like to make sure that you understand that comes first. And by doing level 2, we can carry that safety just that little bit further. Soon we'll be back to level 1 and level 0 will be totally unrestricted and get right back to what we're doing and what we love doing best. So just remember everybody, you're most welcome. Please come back. The girls will call you. If you don't feel like it, that's okay. Let the ladies know you'd rather wait, and we're okay with that. But just remember, this too shall pass. And I'm looking forward to seeing you all back here again.